According to the American Cancer Society, 1 in 8 women will be diagnosed with breast cancer during their lifetime. The statistics are frightening, but it's important to understand that every case of breast cancer is unique and treatable. When caught early, over 90% of women will beat breast cancer.
You always want to find a cancer when it's small. The smaller you find it, the less likely it will do you harm. So less likely to lose your breast, less likely to have chemotherapy. The best way to find a cancer small is to pick it up before you can feel it. That's why we do mammograms.
The media makes cancer screening recommendations confusing, but the key fact remains the same. Regular mammograms are the best way to discover breast cancer in the early stages while still highly treatable.
My recommendations is that if you are of average risk, you should start your mammogram somewhere between 40 and 45. I think it's important for every woman to know that there are benefits and risks to any test we do. So one of the down parts of getting screened is that we could call you back for something that's not a cancer, and you could have a test that we call a false positive. But the benefit is that we can find cancers early. When you look at the studies where they did mammograms every year versus every 2 years, the cancer size increases. When you start doing every 2 years, you're approaching the size that you can actually feel it, which is way bigger than we want it to be. So that's what we say every year. Now, as you get older, the cancers become less aggressive and become easier to pick up. And so as we get older, there is rationale for going every 2 years. But when you're young, the cancers are more aggressive. Your breasts are more dense, they're harder to see the cancers, and that's why we believe every year. So for cancer picked up on a mammogram, non-palpable, your 5-year survival is greater than 95%, and your chance of beating it is greater than 90%. Once you start feeling it, usually you're into a stage 2 cancer, and the numbers drop off radically. Okay, so that by the time you get to stage 4, the chance of beating that cancer is down into 10% range. I mean, that's a dramatic change. And that's why the key is to find it early.
Mammograms are so effective that the American Cancer Society has changed the recommendations for self-breast examinations.
What we know is that the vast majority of cancers are picked up on mammograms to begin with. If you use breast self-examinations, that's the only thing you use for screening, it won't change lives. So what we tell patients is that you don't need to do it every single month. What you need to be, however, is familiar with your body. So in the same way, if you saw a mole on your body increasing in size, you bring it to the attention of your doctor. The same way if you felt a lump in your breast, you bring attention to your doctor.
There are hereditary factors that put some women at a higher risk of breast cancer.
You have to look at your family history, and you're looking for a history of breast cancer on either your mom's side or your dad's side, not just your mom's side. You're looking for a history of ovarian cancer. And in those women who have a very strong family history, suggestive of what we call a genetic mutation, they would be screened differently.
In 2013, Angelina Jolie wrote an article in the New York Times about her decision to have both of her breasts removed.
Actress Angelina Jolie revealed that she's undergone a...
Jolie made the decision based on her family history and the result of a genetic test that showed a mutation linked to an increased risk in breast cancer.
So Angelina's mom had ovarian cancer, and her mom's sister, so her maternal aunt, had breast cancer. So right there, that's a trigger that there could be something in the family causing the cancer. So what are the triggers for thinking of a genetic or family history of breast cancer? If you have someone in the family who gets breast cancer under the age of 50, particularly if you have 2 family members under the age of 50, or if you have someone who has bilateral breast cancer, so 2 independent breast cancers, or if you have a family history of ovarian cancer, if you have a father or brother who gets prostate cancer under the age of 50. Those are all triggers to think of a genetic history.
Although the test is easy to do, it is difficult to interpret the DNA results. It is necessary to find a qualified specialist to interpret the results accurately. More importantly, only 10% of women with breast cancer show a genetic mutation. Over 90% of women with breast cancer have no genetic mutation. Receiving a cancer diagnosis can be devastating and comes with overwhelming amounts of information. Initial cancer diagnosis is based on a pathology report.
Every patient should ask for their pathology report. If it's not given to you, you should ask for it. So when you look at your pathology report, often it's confusing because it's like 7 pages long. I know it sounds stupid, but the first thing I always check is make sure you have the right name on it. On the first line, they'll say overall impression. And there they'll have whether it's an invasive cancer or a non-invasive cancer. So you're looking for those words. And then usually they have the word carcinoma, because you usually don't use the word cancer there. And then you start looking for things like grade. Now, grade is how aggressive the cancer is. It is not the same thing as stage. So we're looking to see whether you're hormone receptor positive, so that's estrogen or progesterone. You want to be hormone receptor positive because your cancer is going to do better than if it's negative. And then we're looking for this gene called HER2/neu, which is a marker of more aggressive cancers. On your report, there may or may not be a statement about your stage. Stage is how far the cancer has spread. And so sometimes you have to ask the doctor, what stage am I? And it goes by numbers. It goes from 0, which is non-invasive, all the way to 4, 4 being when it's widespread. And those are things you need to know.
Every illness involves difficult decisions around treatment options. Treatment decisions are ultimately up to the patient. It is the responsibility of both the patient and doctor to make the most informed decision possible.
Ask why. Why are you recommending a mastectomy over a lumpectomy? Why are you recommending, say, looking at lymph nodes? And if you don't understand why, just keep asking again. Ultimately, the decision about what's being done to you, you're going to make that decision. My job is to educate you. It's normal to be upset. It's normal to be angry. Those are all normal emotions. There are different support mechanisms and everyone's different. Some people like to be in a support group. Others like to be one-on-one with a social worker. It'd be hard to find someone who doesn't know someone who's had breast cancer. Talk to those people. The American Cancer Society will even match you up with someone who's similar in age, who had similar cancer to you, who's out 5 years. And they can help translate some of the words that the physician is saying, whereas if you have someone who's been through it, they can explain to it a lot better. And so take your time. I mean, studies have clearly shown that you don't need to run to the operating room for most people. You have the luxury of time to learn about your cancer. So treatment options have changed dramatically. It's even changing every year, whether it be surgery, radiation, even the way we diagnose cancer is changing. So 20 years ago, you came in, you had a cancer, we do a mastectomy, we take the lymph nodes out, we would give you chemotherapy. Today, we are getting what we call personalized treatments, where we are treating your specific cancer. So we will alter our surgery based on what you have, we will alter the radiation based on what you have, and we'll give you treatments just for your cancer, which may be different from your next door neighbor. And because of that, we have less side effects, but better outcomes.
There is no magic pill to prevent cancer, but there are ways to reduce known risk factors.
You cannot change being female, you cannot change getting older, but there are simple things you can do that will decrease your risk of getting breast cancer. First of all, try to keep your weight down. If you are overweight, try to lose some weight. Try to get exercise. And the amount of exercise is felt to be 150 minutes per week of regular walking or 75 minutes of aggressive exercise. Try to limit how much red meat you eat and try to limit how much cured meats that you have. So bacon, salami, that kind of stuff. It does not mean you cannot have any. It just means it in moderation. Try to limit your alcohol to no more than 2 drinks per day. And I think the key is our diet. So you want to have a wide variety of fruits and vegetables. You want to have things more in their natural form as opposed to highly processed food. There are a lot of things we don't know today that may be important tomorrow. A lot of people across the country were spending billions of dollars on natural supplements and vitamins and things like that. I tell patients that what's in fashion today may not be in fashion tomorrow. So it's better to have a balanced diet.
Early detection is the best prevention. Every woman between the age of 40 and 45 should start their annual mammograms.
Don't be afraid. There are women who will say, I have a breast lump, I know it's cancer, you can't do anything, I'm not going in to see a doctor, and I say that's wrong, because most things are not cancer. Even if it's a cancer, it's usually small. If you're in the right age group, get your mammogram. If you feel a lump in your breast, do not assume it's something bad. Bring it to attention to your doctor, because most things are not cancer. Do not be afraid to get a mammogram. And even if you have breast cancer, we have a lot of treatments today that we did not have even 5 years ago, and the treatments have gotten better. It's very different. I don't think we're ever going to get rid of breast cancer, but I think we can change it from being an acute problem to basically being a chronic disease.